Why are they regulating natural health products? Medical myths and the synergy of herbs. Traditional remedies are disappearing from retail shelves. Why is this? Laws to control natural health products have been passed in Australia, Canada, South Africa, and the EU. A bill is about to be passed by the New Zealand Parliament. The governments say they are protecting the public from risk, but there is no evidence of harm from natural health products. A report prepared in the EU found that natural products were 45,000 times safer than properly prescribed allopathic drugs, and 75 times safer than eating a meal. No coroner in New Zealand has ever recorded a death from consuming natural health products. The 2010 US Poison Control Center report records there had been no deaths from consuming vitamins and mineral supplements despite 60 billion doses consumed annually. The supposed health risks of natural health products are a medical myth created to protect a pharmaceutical monopoly. Plants, animals, and humans evolved together. They share DNA. Human physiology is adapted to maintain health by consuming food that is based on DNA. Natural health products are made from natural plants, animal products, and minerals that are easy to digest. 99% of health factors under our control involve the interaction of 4 areas of our life: food, behavior, experience, and consciousness. Traditional systems of medicine, Indian, Chinese, Maori, and others, nourished all 4 of these areas. Traditional medicine utilized both prevention and cure. This involved the synergy of herbs, acupuncture, oil massage, purification, diet, daily routine, exercise, yoga, meditation, surgery, sound therapy, and many other approaches. Modern research is now verifying the effectiveness of traditional approaches to healthcare. In the 20th century, the rediscovery of personal hygiene and public sanitation led to increases in longevity. Scientists discovered vaccines and antibiotics, which offered miracle cures and created the era of modern medicine, freeing us from feared diseases like TB and polio. Modern medicine was commercialized by pharmaceutical companies, and traditional medicine largely disappeared. Modern medicine was costly. Governments and insurance companies raised money for healthcare through taxes and premiums, which hide the annual trillion-dollar cost from the public. The modern medical system has become a disease care system. The more disease, the more profits. So there is little incentive to encourage the prevention of illness, which is known to be more effective. Governments appointed regulators to ensure that no one was cheated and the public were healthy. Problems began to emerge. Prescription drugs have serious side effects. In the UK, 1/3 of hospital admissions for the over 75s are due to adverse drug reactions. 25% of those patients die as a result. New diseases have emerged, and some drugs have become ineffective. Drugs lose their effectiveness over time and must be taken in greater doses. New drugs are harder to discover. 50% of the population now suffer from chronic or incurable illness. Over 2 million people in the UK are addicted to painkillers. The public started using their own money to buy healthy products based on traditional medicine and modern nutritional research. Natural health products. Doctors have little training in nutrition or alternative healthcare, so there was no link between modern medicine and the natural health industry. Medical doctors concerned about public health began to learn about and use alternative approaches to health. Integrative medicine was born, the best of both worlds. 50 to 70% of the public now buy natural health products. The crisis in modern medicine became deeper. Properly prescribed drugs in the USA became the 3rd leading cause of death. Cancers, diabetes, obesity, heart disease, and mental illness became more prevalent. Of the 1,000 new drugs developed over the last 10 years, 95% lacked effectiveness and only 2 were breakthroughs. Antibiotic resistance is predicted to make life-saving routine operations like hip replacements and appendectomies subject to life-threatening infections by the year 2050. Modern medicine has no cure for a wide range of diseases and can offer only palliative relief for them. A rapidly increasing body of scientific research is pointing to natural approaches to healthcare as a source of new solutions to the crisis. 80% of illnesses are caused or complicated by factors connected with poor nutrition and high stress, which can be alleviated by complementary and traditional approaches to healthcare. If traditional medicine were to disappear, many people who use natural health products will suffer. What does the Natural Health Products Bill say? Clause 4, Regulatory Principles, says natural health products should be safe, regulation should be proportionate to the risks, labels should tell consumers about any benefits or risks. For a large fee, you may apply to make a health benefit claim, which must be supported by scientific or traditional evidence. These principles sound reasonable and fair, but the next clause says, the regulatory principles do not confer any right that is enforceable in a court of law. The bill sets up a Natural Health Products Authority. Clause 36 states the authority may take decisions based on any other matter that it considers relevant in the circumstances. Wait a minute, what does this mean? This is a bill that sets up an authority that may take decisions for any reason it wants to. If you feel you have been unfairly treated, the only thing you can do is ask the authority to change its mind. This is undemocratic and dictatorial. It takes away our rights to justice, choice, and fair treatment. The regulator has already taken unfair decisions that fall completely outside the scope of the bill. You will not be allowed to claim a natural health product can benefit a serious condition. There are fines of up to $250,000 for informing others about even proven natural health options. The bill and the Medicines Act together mean that any product with proven therapeutic value will not be allowed to be sold to the public. It allows unhealthy products like tobacco, sugary drinks, and alcohol to continue to be sold while restricting healthy choices. It permits 3,000 synthetics, chemicals, and additives to be used in natural health products. People with illnesses who rely on natural health products to maintain health could become seriously ill. The bill will permit the use of synthetic ingredients that carry an increased risk. Many synthetics, chemicals, and additives have been approved without testing under the discredited principle of substantial equivalence. Synthetic ingredients are almost always different to their natural counterparts and have different effects. So the result of the bill will be to introduce new risks to health. And it will confuse the public when products labeled as natural are allowed to contain synthetic ingredients. Many medicines have been discovered through research into the medicinal properties of healing herbs. The bill restricts the use of any herb whose properties have been used to discover a scheduled medicine. This creates effective patents for pharmaceutical companies. More than 200 of the most effective Indian and Chinese traditional herbs have been banned or restricted by the bill. This breaches international patent law because natural plants cannot be patented. An absurd side effect of this bill is the restricting of many commonly used ingredients. These include neem, aloe vera, cardamom, betel nut, mustard, green tea, coconut, almond, castor, tamarind, valerian, camphor, and even grapes. It is absurd to pass a law claiming that natural health products, which are essentially foods, cannot benefit serious health conditions. Food is life. It is our first medicine. Did you know that the simple kitchen spice turmeric is effective in preventing bowel cancer? Each year, 3,000 New Zealanders are diagnosed with bowel cancer. Only 55% of them will survive beyond 5 years. There have been many dozens of scientific studies documenting the effectiveness of turmeric. Studies have shown that turmeric reduces the precursors of bowel cancer by over 50% without side effects or risks. If the Natural Health Products Bill is passed, I would not be allowed to tell you this and could be liable for a $50,000 fine. Is it any wonder that natural health practitioners feel intimidated by the bill? The huge fines will have a chilling effect. Skilled practitioners will not be able to advertise. A great many herbs and supplements they recommend will no longer be available. Every day, 13 New Zealanders die from smoking-related illness. No one dies from taking natural health products. In fact, there is a great deal of scientific evidence that they benefit health. Yet the government will continue to allow the sale of cigarettes, while they plan to spend millions of dollars restricting the use of healthy products. The regulations are complicated and confusing. Regulators know very little about the use and effects of traditional herbs and natural health products. However much information you provide, more detail is required. There are over 100,000 edible plants, so the bill will cost a great deal to implement. A list of fees have been published, which will bankrupt many small natural health businesses. All this regulation has little useful purpose, since natural health products are already known to be safe. The regulation is heavy-handed. It will cost a great deal in fees, administration overheads, and testing requirements. Pharmaceutical companies receive billions of government dollars, but natural health product companies will have to pay to be restricted. Companies will struggle to survive, and the public will have to pay a lot more for products. The Natural Health Products Bill is a huge waste of money and resources because it restricts the preventive self-care health choices of the public, while serious and growing problems such as childhood obesity, diabetes, hypertension, ADHD, and anxiety are almost completely ignored, even though they are largely caused or complicated by poor diet and nutrition, which would be mitigated by natural health products. Modern medicine and natural health products are complementary. If you are ill, it is wise to visit your doctor. Doctors are trained to diagnose and treat illness. For many conditions, pharmaceutical drugs are very useful. They save lives, despite the fact that they can create serious and even life-threatening side effects. Natural products and traditional medicines are healthy, safe, and easy to digest. Many have a proven preventive and curative value to strengthen immunity and improve general health. There is no conflict if you choose to benefit from both. If the bill is passed, the opportunities posed by integrative medicine will be lost and your choices will be restricted. The choice is yours. Do you want your safe, healthy, natural medical options to be restricted? It would be morally wrong to support a bill which restricts the health choices of others. Do you want to lose our legacy of traditional medicine at a time when modern drugs are faltering? Are you prepared to trust the same regulators who have banned or restricted 200 commonly used healthy herbs? Or would you rather have a healthcare system that promotes options for both prevention and cure? Act now. An ounce of prevention is worth a pound of cure. If we remain silent, we will lose our right to choose, our voice, and our health. The third reading of the Natural Health Products Bill is expected to take place almost immediately. Write to your MP. Alert your friends and colleagues. To find out more, go to the New Zealand Wellness Association Facebook page.